Now, getting breast cancer during pregnancy or when you're breastfeeding doesn't happen very often, but it can still happen. And that's why it's really important to know what the signs are. If this is you, I can't imagine what you're feeling right now. But remember that it can be treated whilst your pregnancy continues. In this video, I'm going to tell you everything you need to know about getting breast cancer whilst you're pregnant or breastfeeding. And I'll share with you at the end a great charity that can support you and your family during this difficult time. I'm Dr. Liz O'Riordan. I'm a breast surgeon with breast cancer and the author of the Complete Guide to Breast Cancer. I do the research so you don't have to. So let's start with the basics. How many women get breast cancer when they're pregnant or breastfeeding? It's really rare, and worldwide only 3 to 8 pregnant women in every 100,000 get breast cancer. To put it another way, 1 in every 3,000 pregnant women have breast cancer, or 7% of all breast cancers in women under the age of 45. Over 85% of all cancers in pregnancy are invasive ductal cancers, and they tend to be ER negative. How do you check your breasts when you're pregnant or breastfeeding? It can be really difficult to know what's normal when your breasts are changing all the time. And those changes continue for the first year or so after having a baby, depending on how long you express milk or breastfeed for. The signs of breast cancer are still the same, and I talk about them in this video, but they can be mistaken for other common breast problems during pregnancy and lactation. You need to be looking out for things like a lump or a thickening in or near the breast or in the underarm area, a change in the size or shape of one breast compared to the other, a dimple or puckering in the breast skin, an inverted nipple, and fluid that's not breast milk coming from the nipple, especially if it's bloody. Now, in an ideal world, any pregnant or breastfeeding woman with a palpable breast change would be referred to a breast clinic for further investigations. Now, most of those breast lumps won't be breast cancer. They could be things like a blocked milk duct, breast abscesses, or just normal but lumpier breasts. Most skin rashes will be inflammation or an infection during breastfeeding called mastitis. But inflammatory breast cancer, where the skin of the breast becomes red and swollen, can also look like mastitis. So if you've been told you have mastitis and it's not settling after a week of antibiotics, you must go back and ask to be referred to the breast clinic, just in case. Breast cancer in pregnancy is also hard to diagnose because it's so rare. Midwives and breast surgeons may only see a couple of patients in their working life, and family doctors may have never seen one. And I only saw 3 cases in all my years of training. I need you to be pushy. If you're at all concerned, you've noticed a lump or a skin change that seems to be getting worse, not better, over several weeks, see your GP, ask your midwife to refer you to the breast clinic to make sure it's not breast cancer. I know of several women on social media and a couple of friends who had to fight to be referred, which broke my heart when they were diagnosed too late to be cured. Is breast cancer worse when you're pregnant? This is a tough one to answer. We know that younger premenopausal women are more likely to get a recurrence and have more aggressive disease than older menopausal women. We know that the cancers in young women are more likely to be ER negative and HER2 positive and have involved lymph nodes. And because pregnant women are premenopausal young women, if you get breast cancer when you're pregnant, like all the other young women, you are more likely to get a recurrence and your chance of survival is lower than a woman in her 60s or 70s. Now, we're not sure if being pregnant makes the breast cancer behave differently to a non-pregnant woman. What we do know is that diagnosing breast cancer in a pregnant woman is much harder. And pregnant women may only notice a lump weeks or months after a non-pregnant woman would. And that's because, as I said, your breasts are constantly changing. And all of that means that by the time pregnant and breastfeeding women are diagnosed with breast cancer, the cancer is often found at a later stage. This means that it's more likely to be larger in size or spread to your lymph nodes, compared to, say, a woman who noticed a lump in her breast a couple of weeks ago who isn't pregnant. Most studies show that pregnant women respond to treatment just as well as other women of the same age and with the same stage of breast cancer. And that's why you need to be your own advocate and examine your breasts regularly, every month, so you get used to how they are changing, and hopefully it will make it easier for you to pick up anything that feels different or strange. If you're worried about your breasts, keep pushing for a breast clinic referral. Tell your midwife or your family doctor that unless they can tell you with 100% certainty you don't have breast cancer, they need to refer you to a breast clinic just to be on the safe side. I can't stress this enough. Now, most breast problems during pregnancy aren't cancer and are simple to treat, but there's no way of knowing what you have unless you're seen by an expert. How is breast cancer diagnosed in women who are pregnant or breastfeeding? Well, after being examined by a trained professional, you might not have a mammogram, as this radiation can harm your developing baby. If your doctors need you to have one, they will do it using a protective shield on your tummy. If you're breastfeeding, you'll be asked to express milk before you have the mammogram, as this makes your breasts less dense and the scan easier to read. You'll then have an ultrasound scan of any bit that feels or looks different, followed by a biopsy of any suspicious area in your breast. If you're breastfeeding, you may be asked to stop breastfeeding for a couple of days before you have the biopsy. It's common to get quite a lot of bruising after the biopsy because your breasts have a larger blood supply compared to women who aren't pregnant. And if you are breastfeeding, there's a small risk of developing a milk fistula after a biopsy, and this is where the milk can leak onto the skin down the needle tract. And that's why I said some units may want you to stop breastfeeding for a few days first. One major change is how your team look to see if your breast cancer has spread beyond the lymph nodes in your armpit. If you're pregnant, it's not safe to have a CT scan, and that's because the radiation would harm your baby. Instead, if your team are worried, they'll arrange an X-ray of your chest using a tummy radiation shield and an ultrasound scan of your liver. Once you've given birth, you'll then be able to have a more accurate CT scan. Do you need to end your pregnancy to have breast cancer treatment? So firstly, there is no medical reason to end your pregnancy if you are diagnosed with breast cancer at the same time. Having a medical abortion does not lower your chance of having a recurrence in the future. This means that women who keep their baby will probably have the same chance of surviving their breast cancer as those who choose to have a medical abortion. It is your decision, however, and you can decide to have a termination if you feel it's the right thing for you. Do you need to stop breastfeeding during cancer treatment? Most people do. If you need to have chemotherapy, you can't breastfeed because the drugs can pass to your baby in your breast milk and potentially cause harm. However, you can still continue to express milk, you just can't give it to your baby, but this means that your supply doesn't dry up. When you finish chemotherapy, you can then start breastfeeding your baby again. If you need to have Herceptin with chemotherapy, meaning your cancer is HER2 positive, most women will decide to stop breastfeeding altogether. Herceptin also harms your baby, but unlike chemo, you have Herceptin for a year, and that's a long time to continue expressing milk before you can start to feed your baby again. How is breast cancer treated when you're pregnant? Because breast cancer during pregnancy is so rare, there are no hard and fast rules for treatment. Every case is different. Your cancer will be discussed at a meeting with your oncologist and obstetrician, and your treatment will be planned to give the best possible outcome for you and your baby. What you have depends on how far along in your pregnancy you are. Pregnancy is divided into 3 monthly sections called trimesters. The first is 0 to 12 weeks, the second is 13 to 28 weeks, and the third is 29 to 40 weeks, and different treatment options are recommended for each one. These are the basic principles. Surgery. If you're pregnant, you can have surgery in any trimester. There will be an obstetrician monitoring your baby while you're having your operation, and there is a small risk of a miscarriage with a general anaesthetic. If you're breastfeeding, you will need to stop before your operation. This helps reduce the blood flow to the breasts, so the risk of bleeding is lower, and it also helps to shrink your breasts back to your normal size to help your surgeon give you a good outcome. Chemotherapy. If you're pregnant, you can have chemotherapy in trimesters 2 and 3 from week 13 onwards, and this is the most common treatment, and it takes 5 months to complete. You would then give birth, possibly earlier than full term, and have surgery and radiotherapy if you need it afterwards. If you're breastfeeding, as I said before, you will need to stop because the chemotherapy drugs can pass into the breast milk and harm your baby. Radiotherapy. You can't have radiotherapy when you're pregnant because it can harm your baby, and this might affect which operation you have. Radiotherapy is needed after a lumpectomy to reduce the risk of a recurrence in the future, and it's most effective in the first 12 weeks after surgery. If you have surgery when you're pregnant and it isn't safe to deliver your baby in the next couple of months, your team might recommend that you have a mastectomy instead. Can you have a breast reconstruction? It's not usually offered, and for several reasons. One, it's a longer operation, and that means a longer anaesthetic time, which could increase the harm to the baby. Two, there's a higher risk of bleeding as your breasts are more vascular when you're pregnant, and this makes the surgery more difficult. Three, it's hard to give you a good cosmetic outcome as your surgeon has no idea how your breasts will look when you've finished breastfeeding or expressing milk. And that's why breast reconstruction is generally offered at a later date, when you've finished expressing milk. What about Herceptin, targeted therapy and hormone blockers? Sadly, you can't have any of these treatments when you're pregnant because they can all harm your baby. If you need them sooner rather than later to treat your breast cancer, for example, if your cancer is HER2 positive, your team may discuss delivering your baby before you get to full term. What are your chances of surviving if you have breast cancer when you're pregnant? So getting breast cancer when you're pregnant does not mean that you have a higher chance of it coming back or dying from breast cancer compared to a woman with the same cancer as you who isn't pregnant. Your risk of a recurrence depends on your individual tumour factors like size, grade, receptors, whether your lymph nodes are involved, not whether you're pregnant. Will your breast cancer affect your baby? There is no evidence that having breast cancer during pregnancy affects your baby's development in the womb. Can you pass breast cancer on to your baby in the womb or through the breast milk? No, you cannot pass cancer on to your baby, and there is no evidence that your child will develop cancer in later life because you had breast cancer while you were pregnant. And now for the bonus section. How do you cope? Being pregnant is meant to be one of the most exciting times in your life. And sadly, however, this excitement can naturally turn to despair with a cancer diagnosis. It can be really hard to find help from people when it is so rare, to find those that know what you're going through. And that's where a fabulous charity called Mummy's Star can help you. It focuses on supporting women and their families who are affected by a cancer diagnosis, both during pregnancy or within the first year of giving birth. Their website is full of information about how to cope with work, financial aid and benefits, maternity and sick leave, and I can't recommend it enough. It also offers forums for women and their partners and family and advice on how to support you and your children. And if you've been diagnosed with breast cancer while you're pregnant or breastfeeding, I highly recommend checking them out. I'm Dr. Liz Reardon. Thanks for watching my channel, and remember to subscribe so you don't miss next week's video.